Molly Southgate from Pilates Therapy and the Climb Down. Today we're looking at a simple screen for 3 muscles: dysfunction in the Coracobrachialis, the short-headed biceps, and a muscle called pec minor. And we're looking at them particularly and how they influence the scapula. So the Coracoid process is an attachment point that they all share, and that particular bone comes as part of the scapula. And as you can see here, the Coracoid process sits in the anterior portion of the body, and you've got the rest of the scapula that's sitting posteriorly. So if you imagine I was one of those muscles drawing that bone down, it would take the scapula and it would roll it forward. So it would be difficult in lifting your arm, say in abduction, to get that upward rotation that needs to happen, because it wouldn't allow the top of the scapula to rotate in that direction. So it's an important muscle, or an important attachment point with the muscles in terms of preventing things like acromial impingement. So we're going to look at Maria today, and we're going to assess those muscles on her. So I'm going to have you start with your arms just down by your side. So where we look first to assess is the back of the acromion. Now, if I get Maria to give me her hand for a second, in a perfect world, her acromion would sit 2 of her own fingers away from the couch. So I'm looking at her, our fingers are roughly the same size, so I can take my 2 fingers and sit underneath there. And if I show you where the back of her acromion is, you can see that there's quite a big distance between where her shoulders sit and the top of my fingers. And that's on that left shoulder, and then we come back to the right, and the right one is, I'm afraid, worse than the left, Maria. So it's either going to be her biceps, or Coracobrachialis, or her pec minor, or possibly a little bit of both, or all 3. So I'm going to start by internally rotating her arm. If I internally rotate her arm, it should take the Coracobrachialis away, just because of the attachment point. And if I bend her elbow, it will take the biceps away. So actually, as you saw me bending the elbow, you can see that shoulder starts to drop back a bit. So there may be a bit of the short-headed biceps. Let's take the other arm as well. And we start to bend that elbow. And maybe not as much change on that arm. We go for internal rotation. That doesn't have any effect. So I'm going to put her arm there. So her right shoulder did change a little bit with bending her elbow, so she might have a bit of biceps, but her arms with her hands on her tummy, which is elbows bent, they're still quite elevated off the couch, so I'm thinking there will be the pec minor involvement. So I'm going to give her what we call an MET. You can check out what I mean by MET on some of our other videos if you subscribe, and we've got days teaching that technique for releasing muscles as well. I'm going to try both shoulders together. So I'm just going to hold her shoulders here, and I'm going to ask Maria to push down and forward into my hands, just very lightly, so about 10%. And then she's going to take a nice deep breath in. And as you exhale, Maria, just relax. I'm just going to hold it there for a bit. And we're going to repeat the same thing, so you're just going to push forward. Good. And you're going to breathe in. And exhale, you're going to relax back for me. Good. If I take my hands off, you can see that her shoulders have come back to where they belong. So you can sit up for me. Thank you, Maria. So Maria was positive for the pec minor test, and then we've just shown you as a bonus a very simple technique that we can use to improve that. So sometimes if your clients come in with those shoulders coming around, you can narrow down what's causing it, and then we have a really simple, effective technique called METs that you can help address those issues with. If you found this interesting, you can either subscribe, and we've got lots of other videos out there for you to watch on different bits of the body, or we offer courses in shoulders and knees and foot, METs, different techniques for releasing and screening. You can find all the information out on our website www.pilatestherapy.co.uk. Thank you for watching.